Today we're diving into a healthcare challenge that's kind of hidden in plain sight, but it's massive. We're talking about chronic wounds, a problem that affects millions and costs billions. And it seems like a straightforward issue, but the real solution? Well, it's probably not what you're thinking.
So let's get a handle on just how big this problem actually is. To really get the picture, we have to start with the numbers. And honestly, they're pretty staggering.
Okay, let's start with this number. £5 billion. That's what it costs the UK's National Health Service every single year just to treat chronic wounds that won't heal. That is a huge, huge drain on a system that's already stretched to its limits.
But behind that massive financial cost, there's an even bigger human one. We are talking about up to 2 million people just in the UK living with these conditions. They're persistent, they're often painful, and with things like aging populations and rising diabetes rates, this number is only heading in one direction, up.
So you have to wonder, who's actually dealing with this day in and day out? You might think it's a small army of highly trained specialists, but it's not. The vast majority of this care is being delivered by generalists. We're talking community nurses, GPs, and aged care staff. These are incredibly dedicated people who are juggling a million different patient needs every single day.
Now, here's where it gets really, really interesting. When we see a problem like this, our brains tend to jump to one conclusion, right? If the care isn't perfect, then obviously the people doing the work just need more training.
And yeah, at first glance, the research seems to back that up. You've got studies showing that nurses and GPs often say they feel like their original training on wound care just wasn't enough. So the problem seems obvious, doesn't it?
The solution has got to be just pouring more money and resources into training programs. Just get more knowledge into people's heads. It makes total sense. But what if that's not the real story at all?
And boom, here it is. This is the crucial insight that just changes the entire game. The research is crystal clear on this. Just knowing something doesn't mean you'll actually do it. You can train someone on the absolute perfect way to do something, but that doesn't guarantee they'll use it when they're under pressure. There's something much deeper going on.
So if a simple lack of knowledge isn't the real villain of the story, then what is? Well, to find that answer, we've got to look past the textbooks and into the actual psychology of what it's like to practice medicine on the front lines.
This slide just nails it. The myth is that it's a simple knowledge gap, right? Like an empty box we just need to fill up with more information. But the reality is so much messier. It's this complicated knot of fear, of something called clinical inertia, and of system-wide gaps that just aren't set up to help people make the best choices.
Let's dig into that a little. First, the fear of making a mistake. That is a powerful, powerful motivator. And it's not just about the patient. It's about your reputation, your anxiety, your job security. That fear leads to what's called clinical inertia. Basically, sticking with what you know even if you know it's not the best option. It turns out, without feeling a real sense of certainty and urgency, knowledge by itself, it's just not enough to get someone to act.
Okay, so if more training isn't the answer, then what in the world is? Well, the solution isn't about trying to turn every community nurse into a world-renowned wound care specialist. It's about empowering them, giving them better systems and tools that make the right decision the easy decision.
So the new way of thinking is built on these 4 key principles you see right here. Instead of just piling on more and more training, this is a framework that's actually designed to build confidence and make the best clinical choice the easiest one to make. Let's walk through them. First up, you've got to focus only on what's absolutely essential. The goal here isn't to create an encyclopedia of knowledge. It's about what we call actionable awareness. Basically, can a generalist reliably spot the main types of wounds? Can they see the red flags, like a wound that just isn't getting better? And do they know the immediate first thing to do? That's it. That's the bar.
Second, you make decision-making way, way simpler by building tools right into the daily workflow. Think about simple flowcharts or guides for which dressing to use, or even better, digital nudges that pop up in a patient's medical record. There was actually a trial that found these little nudges improved getting patients to specialists on time by 27%. It's all about making the system do the heavy lifting for you.
Number 3 is huge. You have to make it easy and, more importantly, safe to ask for help. Think about it. For a busy generalist, one of the biggest anxieties is thinking, is this serious enough to bother a specialist, or am I just overreacting? If you create crystal clear rules for when to escalate, you take away all that worry. It makes asking for help a sign of being a great clinician, not a sign of failure.
And finally, number 4, get the specialists involved early. Right now, the average delay to get a proper diagnosis can be a shocking 57 days. 57! The goal needs to be 7 days. When you get an expert opinion that fast, it means patients heal quicker, you have fewer complications, and you save a ton of money across the board.
So these principles are great, but the million-dollar question is, how do you actually bring them to life in a busy, high-pressure clinic? Well, it all comes down to designing your whole system for action. And this is how you do it. You build it into the training for every new person who walks in the door. You use those digital prompts we talked about. You give teams real-time data so they can see how they're doing. And you build a culture that recognizes and celebrates when people do the right thing. See, this isn't about making people work harder, it's about designing a smarter environment for them to work in.
And that really brings us to the core takeaway of this whole thing, and it's captured perfectly right here. The goal should always be to build confidence through simplicity, not to overwhelm people with complexity. Which leaves us with a final, pretty big thought to chew on. When we look at all the other tough challenges out there, whether it's in healthcare or anywhere else, how many of the things we call knowledge problems are actually just problems of human psychology, behavior, and, most importantly, system design? It's something to think about.